Hi, I'm Dr. Chip Cole. I'm a quadruple board certified oculofacial plastic surgeon, and today I'm going to talk about lazy eyes. When people refer to a lazy eye, it typically means the eyelid is congenitally weak, and so it's coming down and it gives them a lazy eye. The other term for lazy eye is when the eyelid blocks the development of the vision. People call that a lazy eye. A lazy eye is serious if you're developing your vision, which is usually in the first 7 years of life, because the neural pathways, if it's blocked by a lazy eyelid, you're getting deprivation from stimulus. So you want to get that repaired. If you're older and you're an adult and you have a lazy eye, then your visual system has already developed, and so it's really more cosmetic to get your eyelid put in a natural position so it's not noticeable. By definition, a lazy eye is not a normal eye, but what people mean by that is a droopy eyelid. As a person gets older, that can be repaired. It's very critical if it's a young child, because you're developing your visual system, and so it's not normal to have a lazy eye or lazy eyelid. You want to get that corrected so you can develop normal visual pathways. Someone that has a lazy eye or droopy eyelid, it can be genetic or what's called multifactorial. There's certain syndromes that have a lazy eyelid where people will have ptosis, and they'll also have narrowing of the inner and outer corners of the eye. But most people that get a lazy eye, it's an isolated event that does not seem to be related to a genetic predisposition in their family. Please make sure to subscribe. Fortunately, a lazy eye can be fixed, referring to the eyelid. If it's droopy and it doesn't have good muscle function, which is typically the case, we can put little suspenders from the eyebrow muscle to the eyelid so that when a person moves their eyebrow up and down, it helps move the eyelid. Because there's a limit of how high you can move your eyebrow and how low you can move your eyebrow, at extreme up gaze and down gaze, there's a little asymmetry. But looking straight ahead, it usually is very balanced. When people talk about a lazy eye and whether it looks straight or not, there's two things they might be talking about. One is having the eyelid droop down, that people call a lazy eye, and if you repair the eyelid, then it makes the eyes look straight. Some people call an eye that turns in or out a lazy eye, which is something different, and that involves eye muscle surgery to straighten the eyes.